Hi everyone, my name is Denise and I'm a geneticist and I'll be presenting at the ACNM Health for Life conference this year in 2018. The focus of this conference is mastering the integrative approach, and what that means is bringing together the genetics, nutrition, environmental factors, even gut health in relation to health and healthy aging. So when we say healthy aging, we are talking about aging and avoiding developing those age-related diseases such as cardiovascular disease or diabetes or even neurological conditions like Alzheimer's and dementia. So from a genetic perspective, we all inherit our genes from our parents, and although we can't change them, we know that we can modulate or compensate for some genes with our diet and lifestyle. So we all inherit particular genetic risks and susceptibilities. We're all a little bit different. Some of us have strengths in certain areas. We may be at reduced risk for developing cardiovascular disease, but perhaps at more risk for developing something like Alzheimer's. And through genetic testing, we can identify where these strengths and weaknesses are. And it's not just in relation to identifying risk or susceptibility for disease. Through genetic testing, we can actually identify if someone is more likely to require increased amounts of nutrients. So some of us will require more vitamin A, more B12, more folate, or in particular vitamin D. So we know that vitamin D is important for modulating the immune system, decreasing our risk of developing autoimmune diseases, also important for brain function and reducing risk of depression and mental health disorders. So some of us don't convert and activate vitamin D from the UV radiation in the skin, converting cholesterol into that active vitamin D nearly as efficiently as others. So these people require more vitamin D, whether it's through safe sun exposure or supplementation. So in addition to looking at the genetics and finding about a risk for certain health disorders or age-related diseases and chronic health conditions, we can also find out about particular nutrients that an individual may require more of, but also when we think about environmental factors, on a day-to-day basis, we're all exposed to an increased amount of chemicals and toxins. And some of us genetically are more able to deal with that compared to others. So one quick example is PON1. Paraoxidase 1 is an enzyme that breaks down organophosphates. Some of us can break down these organophosphates that are found in pesticides, so they can be found in our foods, or if you're using things like Roundup. Some of us will be exposed, will break it down and eliminate it from the body, and it's unlikely to cause any health disorders. But others are much more susceptible to this, and therefore they really need to avoid these kind of chemicals and need to make educated choices around foods that do not have pesticides or are less likely to have organophosphates. So in relation to healthy aging, we know that diet is key for healthy aging, good nutrition, but some of us need more of certain nutrients. We know that these chemicals and toxins can directly influence disease, things like mercury with Alzheimer's, but also indirectly through things like oxidative stress, and I'll explain a lot more of that during my presentation at the ACNM conference. So the point I'm trying to make is that your genes are the foundation, and we all have these inherited strengths and weaknesses. But now we can test for these things, and then we can give people advice to tailor their diet and lifestyle to try to reduce these risks and really optimize healthy aging to not only reduce risk of chronic health diseases, but also help people live a healthy and happy life so they can enjoy these later years. And although we want them to be disease-free, you also want to be able to get through day-to-day activities without being in pain and without needing assistance. So I'll be talking about all of this, these interactions between our genes, what we can do to try to compensate for risks that we have inherited. And if you would like to hear more about that, please come along. If you've got questions for me, track me down, and I'll also be involved in some of the panel discussions where you will have the opportunity to ask me a number of questions. So I look forward to seeing you there. Thank you for your time, and bye for now.